In this video, we want to look at the adverse effects of tricyclic antidepressants. Okay, so the thing is, it works on the HAM receptor blockage. It will do what? H1 blocking, HAM, that's how we remember it, right? HAM blocking, alpha 1 adrenergic block, then you have the HAM. M is what? Muscarinic receptor blockers, muscarinic block, right? So these three will lead to some side effects. Muscarinic block you can actually write first. You can write how it will cause atropine-like side effects like dryness of mouth, blurring of vision, right? Then what else? Urinary retention, very good. Yes, urinary retention, then constipation. All these are typical atropine-like side effects, right? If you remember antipsychotic drugs, there we have actually seen this HAM block already, right? In chlorpromazine, haloperidol, risperidone, olanzapine, clozapine, we have already seen this HAM, H1 receptor block, alpha 1 adrenergic receptor block, muscarinic receptor block. All of these are blocking, if you remember. So adverse effects of tricyclic antidepressants, you can write similar to antipsychotics, HAM block, right? HAM block means H1 blocking, alpha 1 receptor blocking, and muscarinic blocking. Muscarinic receptor, if you block like atropine, then you will have dryness of mouth, blurring of vision, urinary retention, constipation, etc. If you have H1 blocking, you will have sedation, confusion. Sedation normally you'll remember for all these antipsychotics also, sedation, right? Then alpha 1 adrenergic block, you'll have postural hypotension. Hypotension means tachycardia can happen, reflex tachycardia, right? Then cardiac arrhythmias, right? Cardiac arrhythmias can happen. So, adverse effects. What are the adverse effects of tricyclic antidepressants? Let us look at them here. The first thing we saw, because of H1 blocking, you will have sedation and confusion. And because of alpha 1 adrenergic block, you can have hypotension, and that can lead to reflex tachycardia, cardiac arrhythmias. Muscarinic block can cause atropine-like side effects like dryness of mouth, blurring of vision, urinary retention, constipation, etc. Okay. So basically this is an anticholinergic effect. Anticholinergic, right? So it will become an anticholinergic type of action. Fine. Then remember, depression, one of the feature of depression is anorexia, right? Depression, anorexia. So now when you give antidepressant drugs like tricyclic antidepressants, the appetite increases, right? Appetite improves. So this can lead to weight gain. So weight gain becomes a side effect. Next point here, it can precipitate convulsions. How do you say this? Why do convulsions increase? Because it is increasing serotonin and norepinephrine and dopamine. It's increasing the levels of these, right? So the firing of the neurons will become more. That's why in anti-epileptic they give GABA analogs, so that the inhibitory action becomes more. Coming to the other side effects, it can actually, this drug tricyclic antidepressant itself, it is very hazardous, and it can cause fatality if you give overdose. Okay. Then before the action is seen, there will be 2 to 4 weeks of lag time. There's a 2 to 4 week of lag time. Where do I write this here? So 2 to 4 week of lag time, and also some patients may not even respond to this drug. Okay. Then what else? Confusion, sedation, confusion we have already mentioned. Then despite anticholinergic action, the person can still sweat. This is a different type of action here. Then there can be sexual distress. Why sexual distress? That we have to explain. See here. The person had premature ejaculation, right? So you gave tricyclic antidepressant, right? Now what happens? Which were the tricyclic antidepressants you gave for premature ejaculation? The drug was clomipramine. That is what you gave, or you can give SSRIs. But here we are talking about TCA. So clomipramine, which you gave clomipramine. It is supposed to make sure that the premature ejaculation doesn't happen. But the problem is there can be delay in erection, ejaculation and orgasm. Okay. There's something here we want to tell you is, the whole point was we were trying to treat the person with depression, right? But it can so happen that with tricyclic antidepressants, the person can exhibit mania. Okay, so mania can happen. Instead of depression, the person may go into mania. Fine, this is a psychotic disorder. Obviously, because increasing serotonin, norepinephrine and dopamine, all these will extra fire. There will be convulsions, mania, psychosis, etc. Let us revise the adverse effects of tricyclic antidepressants. They are so similar to the antipsychotics because of the ham block, right? H1 blocking will lead to sedation, confusion, alpha adrenergic block, postural hypotension, reflex tachycardia, cardiac arrhythmias, muscarinic block, anticholinergic action, dry mouth, blurring of vision, urinary retention, constipation. The person can gain weight, there can be mania, there can be precipitation of convulsions, premature ejaculation. Let me put the diagram here. Premature ejaculation, when you're treating, you were trying to treat that, but the side effect is going to be delay in erection, ejaculation, orgasm. Finally, to tell here, there is a delay in the action of antidepressants, and some of the patients may not even show improvement with TCA. So TCA has lot of side effects, because of which SSRIs are used. So as soon as TCA is you tell now, you have to put your hand on your head like this and say, psychosis, mania, it can cause precipitate convulsions. It will make my mouth dry. It is going to make me retain urine, constipation. It's going to cause hypertension for me. It is going to create reflex tachycardia, sedate me, confuse me. Interesting, right? Good, good. Let's meet in the next video. Please come back. Bye-bye.